I would now like to invite the Honorable Minister for Health and Wellness, Mrs. Sabrina Turner, to deliver her opening remarks. Minister Turner, the elected Member for Parliament for Prospect, she has dedicated herself to enhancing the medical capabilities of the Cayman Islands since she has taken office. As Minister for Health and Wellness, she has been a passionate advocate for improving health care at every level, and she believes in collaborating with the medical community to improve the well-being of all residents of the Cayman Islands. Her inspiring leadership and unwavering commitment will be clear throughout this conference, which I can tell you she prioritizes annually to be here for every minute that she can be, despite her otherwise busy schedule. This time I'd like to invite Minister Turner to deliver her opening remarks. Let's welcome her.
Thank you, Ben, and good evening to our distinguished guests, esteemed colleagues, and valuable participants. It is indeed an honor to be here in celebration of our 15th year of this healthcare conference. As your Minister of Health and Wellness, and understanding maybe in less than 6 months there may be an election here, this could be my final speech as your Minister of Health. But I can stand here and attest that whatever the future holds, I can give you my word that the foundations set during my tenure, we're on the right path. And I know no matter where that goes, because I gotta be a politician, you'll be okay. But I too would like to add my welcome to the Deputy Governor for taking time out of his busy schedule, sharing his personal experience. And it just shows why it's a no-brainer for me to have continued in celebrating an event of this magnitude, understanding the importance of connectivity, networking, and making sure that we reach the public at large. And again, welcome to you for taking time out to celebrate this 15th anniversary. The Ministry of Health and Wellness understands the importance of this conference and what it provides to both professionals and private citizens. And we are grateful every year to continue to make this a success via your participation. Our conference theme this year, as you've heard, and it's all over the place with branding, is the healthcare ecosystem: local, global, public, private. As we all know, health does not exist in a vacuum. It is influenced by our environment, economy, education, living conditions, and individual lifestyle factors, among many other things. Within this context, the interconnectivity, healthcare is its very own ecosystem that operates at a local, national, and global levels across private and public sectors and NGOs. As individuals and policymakers and practitioners, we all have our collective role to play in ensuring that our healthcare ecosystem is one that is thriving. And conferences just like these can help us to better understand and strengthen that ecosystem by providing us with the opportunity to ask questions, challenge and engage one another, network, and find opportunities for greater partnership. The landscape, ladies and gentlemen, of healthcare is continually evolving, and it's influenced by advancements in technology, shifts in demographics, and the ongoing impacts of global health challenges. Our very own theme reflects the interconnectedness of all aspects of health, from the preventative care to the treatment, from the policy making to community engagement. It is through this collaboration that we can build a resilient healthcare ecosystem that benefits everyone. As mentioned, our conference is celebrating the 15th anniversary this year. And anniversaries like this allows us to be and look in retrospect. In looking back at the themes and presentations topics over the years, I was able to see the development of the Cayman's healthcare ecosystem and how much we have done and what is still left for us to do as we work to get where we need to be. For example, in 2010, our conference theme was Envisioning the Future, creating a national vision for innovation, transformation, and delivery of sustainable quality healthcare in the Cayman Islands. One of the key discussions at that theme was health insurance and health insurance reform. While this is an area where work is still being done, I am happy to report that my ministry has been diligently working on amendments for the Health Insurance Act, and some of the proposed changes are fairly comprehensive. You don't realize how short 4 years is until your life and pleasing and serving the people depend on you. Revisions include revamping the scope of what insurance contracts should be regulated and monitored, to the streamlining of processes and everything in between. The updated Act will be accompanied by an updated health insurance regulations, which are also undergoing major review to ensure that these reflect the proposed changes in the Act. 2011's conference theme was Healthcare Economics, the search for quality and affordability, focused on, among other things, building a sustainable and culture of health from an employment perspective. Over the past 4 years, my ministry and departments have statutory authorities have worked hard in helping to create job opportunities in healthcare, as well as to enhance existing training and development opportunities for healthcare workers locally. For example, at the ministry level, this included the creation of a nursing officer, that's the CNO, which amongst other things will offer us the opportunity to be more international in a way that we approach nursing as a career, as a skill set, and as a standard. Having a CNO in post has allowed us for the development of a stronger working partnership with many stakeholders, including UCCI's Ruth Eleanor McLaughlin School of Nursing, with the aim of growing that program and expanding the local nursing workforce. Furthermore, the ministry is also looking at increasing the number of school nurses in our public schools. The Chief Nursing Officer has been leading on assessing the needs for all schools across all 3 islands. 2014's conference was the first time we tackled non-communicable diseases with the theme, Winning the War Against Chronic Non-Communicable Diseases. For those who were with us last year, will have heard me and my team speak about the STEPS 2023 National Health Survey, a significant undertaking by my ministerial team that had not been attempted in over 10 years. We embarked on the STEPS journey in 2022, and following 10 months of planning, 37 enumerators, 5 supervisors, and 24 nurses across all 3 of our islands undertook a 14-week engagement exercise with over 1,900 residents. Our aim was clear. We needed to obtain nationally represented numbers as to determine the national prevalence of non-communicable disease risk factors right here in the Cayman Islands. As I previously stated, the results of this survey will provide insights into the groups within our population currently most impacted by non-communicable diseases, which will allow us to tailor healthcare interventions to meet their needs. It will also assist us in understanding the current barriers to healthcare, particularly preventative care, and how those barriers can be mitigated. Ladies and gentlemen, I am happy to report that the results are in. As part of today's and tomorrow's schedule, my ministry team, made up of our national epidemiologist, our chief medical officer, and chief nursing officer, will be presenting the findings of the STEPS 2023 National Health Survey for the first time publicly, and what these tell us about the health of our Cayman Islands. For the first time, we will be able to have data that is derived from everyone living here, which provides realistic forecasting that will determine quality of life, what resources and services will actually look like in the future. The full report will also be available on our ministry's website as of December 1st, 2024. So keep tuned and definitely look out for this release. Again, this conference is all about asking questions. You don't have to wait for December. All of the right persons are right here in this room. Again, thanks to everyone who participated in making this possible. I have said this many times, and I will say it again. The STEPS 2023 survey results provide data that is of national importance, not only for my ministry, but for those in the healthcare field and everyone living amongst us. STEPS data will also serve to inform our long-awaited National Health Strategy Plan, a blueprint for our nation's healthcare priorities over the next 10 years. Following the public consultation period, stakeholder engagements, and significant research, my ministerial team is in the process of prioritizing the findings in terms of importance and creating a timescale to determine short, medium, and long-term goals. The National Health Strategy and Plan is a significant piece of work that will have implications across the board, much like the STEP survey results. In light of this, we have been proactively engaging international stakeholders as we're keen to ensure that all relevant sectors within government are aware and are engaged in upcoming discussions on how we improve and protect the health of the population. We will, of course, also be working with our private and civil society partners, giving the absolute necessary role that they play and given an understanding of what they play in our society in safeguarding health. We will do our part in engaging the community with the data that we have collected, and we will also work to ensure that they are understood and what this data means for themselves as individuals, families, and our communities at large. Because while we have had many discussions and focused on many themes over the past 15 years, the one thing that has remained consistent is our understanding that health of the nation is shared responsibly with which we all bear. This conference has offered our community a lot of important information over the years, information that has transformed the way we view our health and the healthcare system. Tools and insights that have possibly saved our lives. We've heard the testimonials from our own Deputy Governor. There is much more work to be done, but this event has laid a solid foundation upon which we have been building. I would like to also take this opportunity to thank our sponsors again for helping to make this year's conference a reality. Health City, the conference's premium sponsor, is a longtime supporter of this event, and over the years has provided dynamic speakers who always bring a wealth of knowledge and experience to the discourse that takes place at the conference. Mr. Shamari Scott, Chief Business Officer at Health City Cayman Islands, will also be bringing remarks, as well as presenting on topics of the changing healthcare landscape right here in the Cayman Islands later this evening. We know that budgets continue to be stretched to their limits. So we appreciate the support that all of our local and international sponsors have given us for this important event. We have some new sponsors this year who have joined our family too, and I must say, welcome and thank you. To our esteemed speakers and panelists, both local and those who are joining us from overseas, thank you for being here to share your research, knowledge, and experience. Your input is invaluable, and we look forward to hearing from each of you. We have a number of charities and nonprofit organizations as well, which will be exhibiting at the conference this year, and I would like to encourage each and every one of you to visit their booths and find out more about the important works that they are doing right here in our community. They are the Breast Cancer Foundation, National Council for Persons with Disabilities, Cayman Heart Fund Foundation, Jasmine, and the Alex Panton Foundation. Before closing, I would like to challenge and engage you. I want you to really look at the steps 23, that there is a virtual scavenger hunt that's going around. And I think there are some little QR codes or some scans that you can actually use your smart devices and scan. They're throughout the conference. And you will see information from the STEPS data presented in letter-sized posters on each person's table. Now, this will gather all the information and answer, there's a virtual quiz, to win a Ministry of Health and Wellness prize pack. And in speaking of prizes, I could not let the 15th anniversary go unmarked. Under the seats of 15 lucky winners, there is a sticky note. Okay. And it's not in the notes to wait. I just expected it. Which you can take a look. And if you're a lucky winner, you take that to the ref. There we go. I knew it. It's like clockwork. Interesting. This is amazing. Oh. Congratulations. I'm seeing hands going in the air. There you go. Congratulations to all the winners. Now, any of the persons who were fortunate enough to be sitting on a seat with a sticky note under it, you visit the registration desk to claim a branded gift from the Ministry of Health and Wellness. Thank the team up front. Finally, to the attendees here tonight, thank you for making this investment in your health and committing to enhancing your lives and the lives of your loved ones by seeking out valuable information that will help you succeed. As we embark on this journey over the next few days, I encourage each of you to fully engage and share your perspectives and forge connections that will strengthen our collective efforts, because together we can create a healthy future for the Cayman Islands and beyond. Ladies and gentlemen, thank you again for your time and enjoy this conference. God bless you and our beloved Cayman Islands.